Today I'd like to talk about other methods to get range of motion. We'll look at a few different patient problems. One here with Phil with a total right knee replacement. And these techniques are techniques that I think you should look to a lot sooner in your rehab process than when all else has failed. A few years ago, I started just thinking back to some of our primitive reflexes and tonic neck reflexes, for example. And as I talked about with the shoulder, with the palmar grasp, and what happens and how that activates certain things. And when you look at, for example, using a Biodex machine or a Kincom or any isokinetic device, when you extend one side, if you ever watch the patient, what do? They flex their opposite side. If you ever watch somebody when they do tricep extensions, when they extend their elbows, they go into this neck extension movement. When anybody flexes, what do? They don't extend, they flex themselves. So if we can use these things, you can get some release of some of that motion opposite that direction that you're using that extension moment or that flexion moment. So for example, a typical way, I'm just going to kind of slide around here a little bit, is that if we were going to do range of motion exercises, and if Phil was going to extend this side, right, if he was going to kick out with, let's say, an isokinetic device, or even on a leg extension machine, you're going to see that this side automatically goes into a little bit of a flexion moment. Okay, so why don't we use that in our method here for range of motion? And you know, Phil, if you want to tell a little bit about you were struggling with your motion and you were about to go for manipulation.
Yes, it just didn't seem like it was going correctly, or I was doing enough until John and Julie got a hold of the knee and showed me how to learn to flex it. Keeping the other hip down, just like he was explaining. You do one side, the other side does something else, and it's been great.
All right, so this is a technique that I've talked about in my courses for years, and everybody has tried this in some capacity, where you get natural traction here and multiplanar motion. And from this example, you would get traction, then a little internal rotation, and then you would flex. And that's actually combined motion, which is less painful to the patient. And we had done a ton of that in various positions, both supine, side lying, etc., and prone. And so if I take this, and as we did here, is if I have Phil extend this side, so he straightens out that leg and goes out as I bend, and then release. So it's the same moment as I perform flexion over here, he extends. He can't fight me. That's the beauty of this. You'll see a lot of folks, when you try to go one way, what do? They're going to go the other way, and they're going to overpower you, and you're going to get that reflex of that muscle guarding going. So again, flexion with countered extension on the other side. It's virtually impossible to try to resist that motion. So that is one really nice technique that I'd like you to try. Thanks.